Okay, start.
Hello,
Hello.
this is Dr. Gabla, the doctor in the General Medical Clinic. Are you Mr. Donald Trump, 67-year-old?
Yes, doctor, I am.
So we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So before we proceed, can you tell me how much you know about your condition?
Doctor, this is not a new thing. This is I am suffering quite a few months with this condition. Whenever I do any job, whenever I work faster than normal, I feel a somewhat pain in my chest. After taking rest, I feel better. But this time, this is increasing so much. I cannot even do my own jobs with this pain. So I visited my GP, and he said that it might be some problem with my heart. So he sent me here, and after coming here, your doctor ran some blood test, some imaging test of my chest, and I don't know that what they have find out. Actually, what is my problem? I eagerly want to know that.
I appreciate your concern, Mr. Donald. As you said, all the result and with the image and blood sample with me now, and we are here today to discuss your condition. So this the all lab test reveal that you have a condition called stable angina. Have you ever heard about it?
No, doctor, what is it?
This the condition in which there is an abnormal narrowing in your blood channel which is supply your heart.
So that
Are
is
you
heart
getting
attack,
me?
doctor.
It is not a heart attack, but the blood channel which provide the oxygen and blood to your heart, which allow the heart to work properly, get narrowing. So any further exertion or further effort cause more pain to the increase the oxygen required in the heart, lead to more pain, which the chest pain you are feeling. Did you get me?
Okay, doctor, I get you. That I need more oxygen when I work, so that I feel this pain.
So for that you need to take care for your condition. You should follow your doctor regularly. Maybe he will prescribe you some medication. It help you with the management of this condition.
Doctor,
And
is it a curable condition? I can be totally be normal.
I appreciate your concern, Mr. Donald. This unfortunately incurable condition, but we can control the condition by some treatment which provided by your doctor. You should follow up with your doctor. Maybe he will prescribe you medication. Maybe he will prescribe you some procedure, and imaging can help you further in your to control your symptom.
Doctor, just one thing I want to know that will it affect my life expectancy?
Mr. Donald, I'm sorry to tell you that your condition maybe affect your life and maybe shorten your life. For that, we need to treat it seriously and to follow up seriously with your team and
One
to
minute
take all
remaining.
medication and all follow up recommended by your team.
Doctor, you said that there are some narrowing in my blood cell. Cannot you just change that with operation, or cannot you do anything for that?
There is treatment available, Mr. Donald, but it should be prescribed by your doctor. You will follow up your doctor. Maybe he will help you more in this matter.
Okay, doctor. And if I fine with this, just I do not do any exercise or if I remain at home, will I be okay without any treatment? Taking some natural treatments,
Uh, some what treatment?
some natural treatments like some yoga or some,
Herbal yoga.
yes.
Mr. Donald, I appreciate your concern. In our usual practice, uh, this well-studied
Time of
treat. treat I don't know how to answer this one.
Okay, this is a concern actually. Patient will ask that will I be get better with herbal medication, yoga? At that time, okay, well, as you have started a very good way that we have established treatment and it is uh, it has been found that it is this treatment is good for you. And as you are saying that yoga that helps a little, and we will also recommend this after getting advice from the expert into this option so that you can do certain activities, certain yoga, and a certain natural food that can also help you. But it doesn't replace this established treatment. You should take this established treatment, and along with this, taking those will give you extra benefit. Okay. You explained everything well, and take a little good time to explain all those. And just one thing that oxygen is a medical jargon. Okay.
Oxygen.
So oxygen is a jargon. So for that, we should use a good air, and for the
Mm,
carbon dioxide, we should use bad air. Suppose in case of COPD, there will be some carbon dioxide trapping. We cannot say carbon dioxide trapping. That is bad air trapping. Okay.
okay.
I think the main task was stable angina. So you could give much time on explaining this condition. You explained well, but you take a little bit more time. You could give more time to give me more ideas. What is stable angina? Just like giving me some ideas that we need blood supply, or we need blood to live. Even our hand, our feet all have blood channel, and the heart gives blood to all our body. Heart itself can also get blood supply by three blood channel, or a few blood channel, not by just like three, that with a few blood channel. And whenever if, any of the blood channel gets narrowed, it cannot work properly, so that it cannot supply good food to the heart, good air to the heart, so that when the heart works more than normal time, that they can be given by this blood channel. And at that time, heart do not get proper air, proper food, so that heart cry. And we this crying of the heart we call anxiety, or
Mm-mm.
if you feel like pain. I
Mm-mm.
was told this way, and I have also modified this, but I was told in a better way. I cannot remember that, but as far as I can remember, this was they explained this way, so that the patient can get a better idea that okay,
Mm-mm.
so that up to a level you can tolerate, heart can tolerate this type of less blood food, less food, less good air supply. But after that, heart cannot tolerate this, and at that time, heart cries, heart feel pains, so that you feel this pain. And
Mm-mm.
with this condition, it is a progressive condition. It gradually becomes worsen. The heart channel, the blood channel get more narrower, so that you get this pain with less activity. That also you are suffering, that you are saying that you could uh, you have been less tolerant to the exercise recent time than before. So it is there because it is a stable engine, and it is because this is a progressive condition, and you are not feeling this condition when you are stable or not doing any job. But when you do any job, that at that time you feel that.
Mm-mm.
Okay, otherwise everything was fine. Just one just thing, giving the little idea, more idea, because main task was to explain the condition.
Mm.
Okay, and also patient asked about heart attack, and also you can at that time you can give a warning. It is a heart attack. Okay, it is not a heart attack. There is some narrowing when the blood channel gets totally blocked. At that time, it can develop heart attack. And also patient have a concern. Okay, can I develop heart attack? Okay, whenever there is full block of this blood channel, at that time there will be heart attack. And I am sorry to say that.
Nice.
Can we go for the next case?
Okay.
Hello,
Yes.
I am Dr. Bishash. I am a doctor of this clinic. I confirm that you are Mr. Donald Trump, 67 years old.
Yes, I am.
Okay, Mister. I am here to discuss about your health condition and our further management plan with you. Is it okay?
Okay.
Before I start, may I know that how do you feel now?
Doctor, I came here with chest pain, and they discovered that I have something called angina, and they start me with the treatment. Anything more you want to explain?
Yes, I am here to for your better management. There are certain other factors except those medications, and I want to discuss this condition. So will it be okay?
Okay.
So I want to discuss about some lifestyle modifications. Do you have any idea about?
Well, go, doctor. What do you mean by
Actually, as you all know that you have condition in your heart called stable angina, and in this condition there are certain factors that can affect this condition. Uh,
like what?
like yes, some foods, some habits like smoking, drinking alcohol. They have bad effects on this condition, and with controlling of this condition can also improve this situation.
Okay.
So will it be okay if I ask you a few personal question and proceed further?
Proceed, doctor. No.
Yeah, and may I know that do you smoke cigarette,
Yes.
and how many sticks for how long?
I smoked 10 cigarettes for last 15 years.
Uh, may I know that have you ever tried to quit smoking?
No, no, never.
And if you don't mind, may I know that do you know the side effects or bad effects of the smoking?
They tell a lot about smoking and the bad effect of the smoking that cause cancer, cause heart attack. But doctor, it is everything in my life is miserable. It is the only happiness and I have in my life, and I feel happy when I smoke.
Yeah, actually, I'm sorry for your personal life. And is it okay if I add something to you?
Okay.
And also, like you, a lot of people feel sufferings in their life, and after they talk to the mood doctors, they find that they are getting better. So, will it be okay if I find any alternative for you for this smoking?
But doctor, as I told you, I don't want to quit smoking. It is really pleasure for me to smoke.
Yeah, I can
Why
understand
you
that.
want me to? Why you want me to stop smoking?
Yeah, I can understand that, and I always respect your decision. But as we have talked with our previous many people, and after talking with us, after explaining everything to them, they have decided that they will quit smoking. So I am here, and also this quitting smoking will improve your condition and further management plan. So For that, if you need any help or if you need any information, so that I can hear you, and always I will respect your consideration. I will respect your decision.
But doctor, I have diabetes, I have hypertension, I have high blood pressure, I have high cholesterol. After all of this, you are going to blame only smoking?
No, actually, we are going to give medication for to control of this condition. And as I have told you that there are certain modification, certain lifestyle changes that can improve this condition. Just like smoking, and also I have told you certain foods, they have some bad impacts on the lifestyle, on the disease condition. So it will really improve your condition after you can control this. 1 minute remaining.
So, doctor, instead, I promise you, I will try my best to stop smoking. But can I reduce the amount instead of stop?
Okay, always I respect your decision, and I can provide you with some leaflets so that you can get a better idea that how people find that how can stop it. And also, if you have any special concern in your life that you do not want to quit smoking for that, then if you like to share, then I can always take care of that.
But you don't answer me. Can I smoke, for example, 1 to 2 cigarettes per day instead of
I'm
stop totally?
actually smoking at any amount is harmful. And if you think that you can smoke, or you want to smoke 1 or 2 sticks per day, then you can. But I can tell you that even a single amount of smoking is injurious to health, and certainly it will cut down, and it will bring less effect as you cut it down.
And every time, doctor, I try to stop smoking. Uh, I I I feel that am restless and need to go back to smoking. Is there anything can help me in this method?
Okay, a lot of people also suffer this, and they have complained this to us. For that, we have a special dedicated smoking cessation clinic, and they can handle this condition in a very good and uh, professional way, so that you will not feel this condition, and you will feel a better stage of quitting smoking. And if you like,
How are you going to give me some medication?
I can make an arrangement with the smoking cessation team, and they will discuss your condition, and they will uh, talk about the medication or any other alternatives they have. And after talking with you, they will go for that which would be the better option for you.
Okay, thank you, doctor.
Thank you. Time up and 2 minutes more. I already told the time up.
Yeah, I heard you.
Okay, so do you want to comment on anything?
I don't know exactly what required here, but in the smoking cessation scenario,
If,
they
if
discuss a lot of step and how we refer to
yes, a lot of
smoking cessation
a lot.
and the option for medication
And
and
also
the
a lot of questions could be asked in the initial, but due to time, I couldn't ask those. People are talking about smoking. I should have been more
craving
polite.
and to avoid the friend who smoke with, to
Yes,
avoid the society you smoke with, and to change the habits. And
yes. That is a non-smoker society. I can refer him to that. He can avoid any certain activities that can provoke anxiety, that encourage him to smoke. There are certain lot of things. I couldn't cover all those.
And should we discuss the tablet, that each tablet, what contraindication, what?
No, 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 no. That is the duty of the smoking cessation clinic. We are just explaining the importance that why he should stop smoking, because it will improve her lifestyle and improve her disease condition, improve his disease condition. We're not talking about the options. There will be a lot of options. We have to take care of many of things. Any depression, any previous history of seizure, lot of things. Do you want to add anything, or I go for the next case?
Did you set agenda?
Okay, start.
Hello,
Hello.
this is Dr. Gabra, the doctor in the clinic today. Are you Mr. Donald Trump's 67-year-old?
Yes, doctor. I am.
So we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So before we proceed, can you tell me how much you know about your condition?
Actually, doctor, I had this chest pain for a long time, and for that, my GP prescribed some medication and some spray. And this time, I also take those medication, take that spray, but my chest pain wasn't going away. And I thought that there might be something abnormal, that my previous heart condition they called angina that have worsened. So I came to the hospital emergency, and they ran some test, and they said that there might be something abnormal. So and after that, they gave me some medication, some oxygen, but I couldn't talk with any of that. What happened to me? Can you please explain?
I appreciate your concern, Mr. Donald. What happened to you that you have already established condition in your heart, that there is narrowing in your blood channel that supply your heart muscle, and on top of that, uh, there is clot formation come to this blood channel and cause total blockage of this blood channel. So the blood supply to your heart muscle stop totally, and unfortunately causing die to this tissue, lead to your symptom of chest pain and this chest comfort, and what you have had suffered.
Doctor, and is it related to my previous heart condition, or is it a new condition?
Yeah, it is related, as I mentioned to you. You have already a problem in your blood channel, and on top of that, it complicated by total blockage of the blood channel.
That is something scary. But I took medication previously, doctor, and I took them regularly. Why even I have this condition again?
Sometime even with the after we take this medication, there will be also chance of this heart attack to be happening,
Doctor, that is
because there is already risk factor for that.
that sounds scary for me, doctor. And you said there are some dying some muscle of my heart.
Yes, unfortunately, because of stop of the blood supply to the muscle, it causing dying and total injury to the heart muscle and specific area of the heart that supply by this blood channel.
Good, doctor. So what will you do now? Give me some medication.
This will be decided by your treated team. If you come within specific time, they can give you a medication that can uh, s- solve this clot. Otherwise, there will be treatment to have a blood thinning to your blood, and controlling your blood pressure and your blood sugar and reduce the cholesterol in your blood.
Should I remain to the hospital or can I go home for taking some medication?
You need to stay at the hospital for some time for observation, and you will be followed up by your treatment team, and you will be given specific treatment,
1 week
and
training.
you need rest during this time. Please avoid extra effort or exercise, and do you drive, Mr. Donald?
No, doctor. Doctor, just one thing I want to know. That is it a stroke?
No, stroke is something different. Stroke, it is blockage of the blood channel which supply the brain. But this different, this blood supply to the heart, something different.
Will not my heart get better again?
Unfortunately, the muscle injured by this attack will not cannot able to come again. But with continuation of treatment and rehabilitation, your heart can bring back some power some power again.
Time up. Okay. You have explained everything well. That was fine. You have explained that condition, myocardial infarction, that was also fine.
Should I mention about lifestyle after my cardiac infarction and
No, your task was
modification?
to explain myocardial infarction, and you have explained that in a very good way. If there are certain blockages for that, I that some part of my heart muscle couldn't get air and food, for that I developed this condition. There was some other questions that can I even die after taking those treatment? What would be your answer?
Yes, there is a chance for dying
Okay, you're
because
saying yes, there is a chance. Yes, I think you should have tell something. I'm sorry, or I am afraid.
there, yeah, there is a chance, but you will be in good hands. We will follow up you closely and will minimize the chance as much as we can.
Okay, and is this condition? If I have this condition, will it affect my lifestyle or my daily life?
Uh, Mr. Donald, I appreciate your concern. This you have heart attack. You need to have rest for some time, uh, uh, and you need to modify your lifestyle. You will follow special diet and special exercise. You need to avoid your شو اسمه شو اسمه treatment يعني sex شو what we can say for sex
There will be some restriction on the.
ultimate sexual activity, and you need to avoid the driving and to avoid extra exercise or extra effort.
Okay, fine.
And you need to continue on your medication and follow up by team.
Okay.
Ready.
Okay, start.
This Doctor, hello.
Hello.
This is Dr. Gabra, the doctor in the cardiac clinic, heart clinic. Are you Mr. Donald,
Yes,
67
doctor.
year old?
Yes, doctor. Yes, I am. I wanted to talk about with the doctor about my condition. So, are you? Do you like to talk or make something clear about my medications?
Sure. I am here today to discuss your condition and further medication plan. Do you have any concern for me?
Yes, doctor. Just after I came to the hospital with chest pain, my doctor said that I have heart attack, and they treated me, and I am fine now. But my nurse just a few minutes ago gave me a medication list and said that I have to take this medication at home. So why will I need to take those medication at home? I am fine, doctor. After getting the treatment, I don't have any problem. Will I
Mm,
even have to
I
take
ap-
this medication?
I appreciate your concern, Mr. Donald, but as you know, Mr. Donald, you have been diagnosed with a heart attack, which is a serious condition, and this condition caused by several risk factors. Why we give this medication now to reduce all this risk factor? As consequence, we will reduce the chance for this heart attack to happen again, because there is a chance to be happen again. Are you with me?
Okay, doctor. So you're giving all the medications to reduce my chance of having heart attack in the future.
Yes. Do you want me to explain more about this medication?
Okay, doctor. Just a lot of
The
medications. So why I am
Yeah,
taking those?
there is medication given to let the blood be as blood thinning, so it avoid blood to clot again. There is medication to control your blood pressure, so you'll not have high blood pressure causing more harm to your heart. There is medication to control your heart rate, so your heart will pump slow, and it reduce the air consumption by your heart. There is medication to reduce the cholesterol in your body. Are you with me, Mr.
Okay, doctor. I can
Donald?
I can understand that you are giving these medications for me fine, but I cannot use us to do anything, any operation, so that I do not need to take these medications daily.
Mr. Donald, this will be discussed with your treatment team, but even with the procedure and operation, you need to take medication to control all this.
Okay, doctor. Then you are all ending up with the medications, but I live alone and I cannot make take those medications regularly. Will there be any problem if I just miss a few doses?
Why you expect to have those doses?
Doctor, I live alone and I have to maintain my own works. And I cannot regularly take these medications because
Mr.
quite
Donald, there is many way to remind you by taking this medication. You can set reminder. You can assign somebody, some friend to remind you about medication. You can set activities, special activities that take in the same time. So it's very important not to miss any medication, so you will not have the attack again.
Doctor, and are you sure that this will not bring this type of condition again?
This I appreciate, Mr. Donald, your concern. This medication only reduces the chance for recurrence, but I cannot assure you there is nothing in medicine
1 minute remaining.
uh, guarantee 100%, but it reduces the chance rather than prevent
Okay, doctor,
100.
and will I get any side effect from these medications?
Mr. Donald, I appreciate your concern. Every medication has its own unwanted effect, but this medication will be given in uh, minimal dosage needed, and to reduce the side effect. Some medication causing reduce in your blood pressure. Maybe you will have some stomach ache. Maybe you will have lightheaded. Maybe blood thinning medication can cause skin discoloration. Maybe you'll have bleeding in your urine, or water work, or
Time up.
bowel work.
Okay. So truly speaking, everything was so fine that I hadn't any question to ask that were given. Okay, you have explained everything well. That I why I should take those medications regularly, and I am also living alone, and you have gave me some solutions.
Is there any other solution?
There are certain solutions that like asking the social care team so that they regularly review your medication and they can regularly review and they remind you to take these medications. That someone will do it voluntarily. That will take care of him at his work or at his home, and they will regularly remind him that you should take the medications. Okay, and all of your solutions that were fine. Okay, I don't have anything to talk about this scenario because you are so fine. Do you yourself want to add anything?
No.
Okay.